Hello, and thank you for all of your wonderful questions. Let's answer some of them today. So they're in no particular order. I just picked out a bunch that maybe a lot of people would want to know about, and of course ones that many people have asked me about, and I've gotten that question a lot of times. So alleviate headaches, jaw tension, and general anxiety with this relaxing face self-massage. The reduction in tension has blown my mind. That's awesome. If practiced regularly, can it become a preventative modality? Absolutely. Yes, that's what we're talking about. It's doing things regularly, right? Sticking to a schedule. You got to keep up with practices for them to really be effective. And the more you do it, the more effective they are over time. So yes, absolutely. Not only can it help with any discomfort that you're feeling at the time or any pain that you've had, but if you keep at it, it will be a preventative. So those symptoms don't return and you get all the benefits as you go. For self-massage for thoracic outlet syndrome. Hi, I just started this routine, but don't get a sensation of softening in the muscles. Am I doing it wrong? Again, no, no. As long as you're not hurting yourself, you're not doing it wrong. And sometimes that softening that I'm talking about is just a visualization first. Sometimes you just have to imagine it first, and you would be surprised how powerful that is. That actually makes a difference to visualize things. I don't know if you know about this, but for people who maybe they're in so much pain, they're not able to move, say a limb, not able to move a hand, maybe the hand is really, really arthritic or something like that. Before they're able to move it, usually it's in PT, I would think, they visualize moving it. Moving my hand down, moving it up, spreading my fingers, bringing them down, and they just visualize again and again. And eventually, they're able to do this without pain. And then eventually they're able to do this. And little by little, just from starting with that visualization, because you are creating those neural pathways, those connections that need to be in place to make the action happen. So same idea with this. If you don't feel it right away, keep practicing and it'll get there. You just visualize, you relax, you do what you can, and then you will find it, and everything will eventually soften. And listen to your hands and listen to your mind. Alleviate headaches, jaw tension, and general anxiety with this relaxing face massage. Can you explain the science behind why it's so relaxing when we breathe in to a specific area? It's so relaxing. I know, right? It's really relaxing. So again, this is a visualization, right? You don't actually breathe into, say, well, this is for the face. You don't actually breathe into the forehead, right? You're breathing into your lungs. But imagining it is relaxing the area, right? You're imagining the breath going in and kind of filling everything with oxygen and nutrients and good vibes or whatever, and then exhaling all the tension. So it's just a way to sort of visualize a release of tension, which, as we know now, is actually making a neurological, physiological difference in the body just by visualizing it. The other thing that helps is that this is now giving you a one-pointed focus, right? So if we are focused on, say, just alleviating tension, breathing into the forehead to alleviate tension, we're not thinking about our to-do list, our kids, our relationships, our work, our everything else that's always on our mind that's causing us grief or anxiety, because now all of our attention is just within, right? In our bodies, and trying to alleviate this one place and just breathing. So it puts everything else away and it gives us a one-pointed focus, which is basically meditation. Meditation normally starts with a single focus, like the breath in and out, or like focusing on your hands, or focusing on sounds that you're hearing, something like that, which really closes off the rest of the world, gets you in touch, gets you in the present moment, right? Because so much of the time we are ruminating about the past or worrying about the future. So if we're paying attention to what's happening right now in our bodies, right? In our environment, in our space, in the present. We cannot be thinking about the past or the future. We have to be here now. And that is a huge anxiety reducer, to be in the present moment. That's where we want to be all the time, because that's actually the only thing that really exists. The past is over and done, and there's nothing we can do about it anyway. So, why think about it? You're just causing yourself grief. And then the future doesn't exist. And honestly, about 90% of the things that we worry about never happen. We just let our minds love to go out and find problems, right? It's our survival instinct. They're looking for all kinds of things that can happen. And the mind will do that. Let it do that, but watch it. Be aware of it. Say, hey, thanks, mind, that, I'm really appreciative that you want to help me out, that you're looking out for me, but I'm good. Come back to the present. Come back to the present. Always coming back to the present moment. Got off on a little tangent there. That's okay. Let's see. Reduce acid reflux with self-massage, breathing, relaxation. Hi, can I do this massage after eating? I wouldn't. We're really going into, I think this one we kind of address the tissue surrounding the diaphragm and things like that. So you don't want a full belly. I mean, if you've had a very light snack, but I wouldn't do it after eating. If you're having a meal, I would wait like at least an hour after a small meal, couple hours after a larger meal. You want to do this on a pretty empty stomach. Calm your anxiety in 2 minutes. How long should I do this exercise? Well, as long as it takes. So if you're finding that it didn't work the first time, which is very possible, it's only 2 minutes, repeat it. See if you do it a few times, it feels better. If you enjoy how it feels and you think you could do more and see if it helps more. It's not like you can overdo a simple anxiety breathing relaxation. I mean, I guess if you're doing really deep breaths for a very extended period of time, that's not so great for respiration. But I mean, you could do it several times and just see how your body responds and see how it calms down. A really good thing to do is up the frequency. So do it in the morning, middle of the day, and at night, or whenever you think about it. When you're standing online at the supermarket, maybe you don't want to do the tracing in public, but you can do the breathing relaxation techniques. So doing shorter periods of time with it, but scattered throughout the day, that might benefit you a lot more than just doing one long session, because it's that sort of repeated feedback, right? You're creating those new neural pathways that say, we know how to breathe, we know how to relax, we know how to do this, right? It's that reinforcement over and over and over again. So the more frequent, the better. Amazing self-massage for runners, relief pain and tightness in legs and feet. Do you think that this self-massage is better than foam rolling or using a roller stick? What is the difference? It is up to you. What works for you? If you are a runner and you find that using the foam roller or the roller stick is very beneficial and keeps you from getting injured and keeps you healthy and limber, then go for it. What I like about using hands is that you can get all different kinds of pressure. So you can use fingers, you can use fists, you can use knuckles, you can use forearms, you can use up. So you've got a lot of different tools to apply pressure, and you might have a little more control over the pressure, as opposed to if you're saying lying on a foam roller, it's a little more difficult to sort of balance your body weight and get up and down. However, it does save your hands and your arms. You don't have to do that aspect of it. So a foam roller, depending on its hardness, and most of them are usually pretty firm, and certainly a roller stick may be too much for some people. That could be really, really intense. And you don't want to cause pain. That's number one thing. If you're causing pain, you're going in the opposite direction. Your muscles are going to tense up. You're going to activate that fight or flight mechanism. You're starting to create stress hormones. It's completely the opposite of what we want to do. We can't possibly relax our muscles, alleviate tension, and allow our bodies to rest and recover if we're causing pain and exciting the nervous system, right? So if you are able to use a foam roller and rolling stick comfortably, I mean, there might be a little discomfort, that's okay, but you want to keep it in the, like kind of intense, that's kind of uncomfortable, but it also feels like a good release, and definitely not in an ouch or a grimace or a, ooh, this is just unpleasant, when's it going to be done? You don't want to go there, okay? So if you're able to keep it low, then pain levels low, or discomfort low, then go ahead and use the foam roller and rolling stick if you'd like to. If not, and it's too much, go with the self-massage with the hands and maybe work up to using a foam roller or rolling stick if that's your goal. But they just approach it differently, get different angles, different directions of muscle fibers. So if you've never done any, then, totally experiment and see what works for you. It's all different. Maybe you want to mix it up. Maybe you find that you can access some areas better using your hands, some areas better using the foam roller. So go for it. It's all self-massage. It's all good as long as it's helping. How to ease stomach pain, acid reflux, constipation, and gas with self-massage for digestion. Someone asked, can this be done in the first trimester? I would keep any abdominal massage really, really light for any time during pregnancy. This is the time that you can apply some a little bit of oil, very plain, or a little bit of moisturizer, and just sort of rub gently over the belly. If you would like a more specific massage, I would go to a massage therapist who is certified, trained, has expertise in pre and perinatal massage. But as far as, digging into your own abdomen when you're pregnant, I wouldn't do it. I'd go real, real light. Ears self-massage to help you recharge. Would you consider this wonderful massage as a vagus nerve exercise? Self-massage your knee pain goodbye. I've got one question. Why did she start with a pressure massage toward the knee, but every other article about how to relieve pain on knees suggests to apply pressure massage upward or towards heart to improve blood circulation? Can anyone who has expertise answer me? Okay, so that used to be true for what was called circulatory massage, okay? And then if you're doing circulatory massage, which is kind of light, long strokes, that was said to be best if you did that towards the heart to improve systemic circulation. We know now that that is a common belief that is not supported by scientific evidence. Okay, so there's nothing that says that massaging somebody is going to improve the blood flow throughout the body. The best thing you can do to improve your blood flow is move, exercise. That is what's going to pump the blood, pump the lymph, get everything going. Massage maybe locally will get some heat and get some blood flow to the area, but we have not seen, with as many studies that have been done, that it creates a systemic improvement, increase in blood flow throughout the body. I don't even know if we want to increase blood flow throughout the body. It usually is working pretty well on its own. So you don't have to worry whatever direction you're going in. There is nothing bad there. It's based on a myth, and it wasn't even the technique that we were using in that particular video. So no worries. Okay, on my stretching for the IT band, I'm a big fan. What would be a reason that I can't feel any of these in my IT band or near it? I think I'm doing them right. Okay, so I explained in the video, you can't stretch your IT band. That's a trick. The IT band is like a thick, meaty band that cannot be stretched. It would take like massive power to be able to actually stretch the IT band, and within an instant it would tear. So we don't want that. What we are stretching are the musculature and tissues around the IT band, okay? So like in the hip and around the knee. So that's where you might feel the stretch. If you are feeling it more in the lateral hip, the outside of the hip, it could just mean because that's where you're going to feel the stretch where you're tightest, right? You're going to feel the stretch where there's the most restriction, the most tissue restriction, and where you need it the most. So if it's the outer hip, maybe your gluteus medius is restricted. If it's sort of the lower leg, maybe it's the peroneals, anything outside of the knee, anything like that. You're going to feel where it's most restricted. If you're not feeling a stretch at all, you just may be very limber, very flexible, and that area may not need to be stretched at all. So, yeah, but it's probably not that you're doing it incorrectly. You're probably doing it correctly. And if you're not sure, I love to wiggle in stretches. You can like move around a little bit, see where you feel it the most, see where it feels good, change the angle a little bit. Do I get a better stretch this way? Maybe you want a little more of a quadricep stretch and that's where you feel it the most. So feel free to play and move around and explore. That's a great thing to do. You get to know your body. You get to know where you need some work, where you need some attention, and what feels good. Well, guys, thank you so much for all your wonderful questions. We will do this again. And I think this is great. I love answering your questions. I love your comments. Subscribe, like the video, all that stuff, comment below. Let me know if you have any other questions or what you thought of this video. If you'd like to see more of these videos answering your questions, please join my membership. It really helps. It really helps. I love making these videos for you. They're free to the world, and I could really use your support to help me keep going. And you get some membership perks, which are fun, and I love interacting with you that way and building relationships with you. So definitely check that out. I'll see you soon.